It's crazy how connected everything is these days. Something happening on the other side of the world can suddenly be really important to us.
Yeah, it really shows you how small the world is.
Like with this recent detection of poliovirus in European wastewater, it makes you stop and think.
For sure, it's a reminder that even in places where we think a disease is gone, it can still be lurking around, especially if there are people who haven't been vaccinated.
We've got a bunch of sources here that dig into some global health trends, and they all kind of point to that same idea of interconnectedness.
Right, like how our health is all tied together no matter where we live.
We'll be looking at this poliovirus situation, exploring how airplane wastewater is being used for disease surveillance.
Oh, wow, that's fascinating.
It is, and we'll even be talking about how AI is being used for big scientific breakthroughs.
Sounds like a packed show.
It is, so let's jump right in. Started with that poliovirus discovery. This specific type, vaccine-derived poliovirus type 2, was found in wastewater in 5 European countries: Spain, Poland, Germany, the UK, and Finland.
And that's a concern because even though Europe is considered polio-free, there are still those pockets of unvaccinated people who are at risk.
Exactly, and it shows how important it is to keep those vaccination rates up everywhere.
Absolutely. And the chances of actually getting polio after being infected with this virus depend on whether you've been vaccinated or not.
So, what are we talking about here in terms of risk?
Well, for people who are unvaccinated or haven't received all their doses, the risk is estimated to be somewhere between 1 in 200 and 1 in 3,000.
Wow, that's a pretty big range.
It is, but regardless, it highlights why it's so crucial for everyone to check their vaccination records, make sure everything is up to date.
Seriously, it's not something to mess around with.
Right, and it's also important to remember that even if you're vaccinated, the virus can still spread silently through people who don't have any symptoms.
That makes those everyday preventative measures even more important.
Absolutely. One of our sources actually talked about some practical tips from an expert named Erwin Dusser.
Oh, what did he have to say?
Well, he really emphasized things like proper hand washing with soap and water. He said that the ethanol-based hand sanitizers aren't as effective against this particular virus.
Interesting. I use hand sanitizer all the time.
Yeah, it's definitely good for a lot of things, but for this specific polio virus, soap and water are the way to go.
Good to know. What else did he mention?
Something that most people probably wouldn't think about, closing the toilet lid before you flush.
Oh, right, to minimize the spread of droplets.
Exactly. It's something we can all do easily to help prevent the spread.
Simple but effective. Okay, let's move on to this next topic. It sounds like something straight out of a sci-fi movie using airplane wastewater to watch out for potential pandemics.
I know, right? It sounds super futuristic.
It does, but apparently it's a real thing. Analyzing wastewater from airplanes can act as an early warning system for new pathogens.
Wow, that's amazing. And it was actually used to detect this poliovirus in Europe, wasn't it?
It was. So how does it actually work?
Well, scientists are really focusing on time to first detection as a key measure of how effective these aircraft wastewater surveillance networks are. The idea is to catch potential threats as early as possible.
That makes sense. Early detection could be huge in stopping outbreaks from getting out of control.
Absolutely. And research suggests that even with a relatively low chance of detecting something, analyzing wastewater from about half of all incoming international flights could drastically improve detection times.
That's amazing. It's like having a global network of sensors constantly on the lookout.
Exactly. And our sources mentioned that the accuracy of figuring out where an outbreak started gets better as more data is collected from different airports.
So the more information we have, the better we can track the movement of these pathogens and pinpoint their origin.
Right. And what's even cooler is that this same framework could be applied to other surveillance methods too, not just airplane wastewater. It has the potential to completely change how we monitor global health threats.
That's exciting. Okay, let's shift gears a bit and talk about another ongoing concern, MPox.
Right, MPox, it's still out there, and our sources indicate that there are 2 main types of the virus circulating at the moment.
2 main types. So what's the difference between them?
Well, the current MPox outbreak is mainly driven by what's called clade IB MPXV.
Clade IB MPXV.
Got it. It originated in the Democratic Republic of the Congo and has spread to neighboring countries like Burundi and Uganda.
And this is where we see that interconnectedness coming into play again, right?
Exactly. Our sources mention a case in the United Arab Emirates, their first case of this particular clade of MPox, and it was linked to travel to Uganda.
Wow, that really shows how easily these infectious diseases can spread through travel.
It does, and it highlights the importance of having strong global surveillance efforts in place.
For sure. So is Uganda where most of the cases are concentrated?
Well, it has the second highest number of confirmed cases in Africa.
Oh, wow, I didn't realize that.
But what's concerning is that they're also seeing a rise in weekly cases, unlike the more stable trends in the Democratic Republic of the Congo and Burundi.
That is a bit worrying. Okay, let's switch gears again. One of our sources mentioned this initiative in Singapore called Verowell SG. It seems like they're taking a really proactive approach to children's health.
They are Growell SG aims to help kids develop healthy habits from a very young age, starting in primary school.
So we're talking about things like eating right and getting enough exercise.
Exactly. They're also addressing things like too much screen time and not enough physical activity, all things that can have a big impact on health and well-being down the road.
It sounds like a really comprehensive program, so how are they actually going about tackling these issues?
Well, they're focusing on personalized health plans for each child.
Oh, that's interesting. So it's not a one-size-fits-all approach.
Not at all. These plans are based on data gathered through yearly questionnaires and health screenings, so they can tailor recommendations to each child's specific needs.
That makes a lot of sense. I imagine it makes it much more likely that kids will actually stick with the program.
I would think so. And it's not just about individual behavior change, they're also working to create a supportive environment in schools and communities.
What does that look like in practice?
Well, for example, they're working with schools to implement healthier meal options.
That's great. So kids are getting nutritious food at school.
And they're also increasing opportunities for active play during the school day.
I like that. It's about building those healthy habits into their daily routine.
Exactly. They're really trying to address the problem from multiple angles.
It sounds like a great program. Okay, let's talk about something that's been getting a lot of buzz lately, artificial intelligence or AI. We've all heard about it, but its potential in healthcare and scientific research is truly remarkable.
It really is. We've talked a little bit about AI already with things like disease surveillance, but let's dive into how AI is being used for big scientific breakthrough.
I'm all ears. This is a topic I find fascinating.
Me too. One of the most groundbreaking achievements has been AI's ability to solve the protein folding problem.
Protein folding. Now, that's something I remember learning about in biology class, but I have to admit it always seemed incredibly complex.
It is complex. Imagine a string of amino acids folding into a specific 3D structure.
Okay, I vaguely remember that.
Well, that structure determines what the protein does, how it functions.
So the way the protein folds is crucial to its function.
Exactly. And traditionally, scientists used methods like X-ray crystallography to figure out these structures, but it was a slow and expensive process.
So how is AI changing all of that?
AI programs can now predict these 3D structures incredibly quickly and accurately.
Really, that's amazing.
It is. It's thanks to the combination of massive computing power, huge data sets of protein structures, and innovative AI algorithms.
So AI is essentially crunching all this data to figure out how proteins fold.
That's a good way to put it. One key type of algorithm is called a transformer, which is also used in those large language models like ChatGPT.
Wait a minute, so the same technology that powers chatbots that can write poems and answer questions is also being used to solve complex scientific problems.
It is. It's pretty wild, right?
That's incredible. So tell me more about how this AI program that can predict protein structures actually works. What's it called again?
AlphaFold.
AlphaFold, right? So how does it do it?
AlphaFold uses information about a protein's amino acid sequence and its evolutionary history to predict its 3D structure.
Evolutionary history, what does that have to do with protein folding?
It looks at which amino acid sequences have stayed the same across different species and which mutations have happened together, suggesting those amino acids are likely near each other in the final folded structure. It's like a detective piecing together clues to solve a puzzle.
That's a great analogy. It sounds like AlphaFold is a game changer in scientific research.
It definitely is, and the results have been spectacular. AlphaFold 2, the newest version, has actually reached accuracy levels comparable to experimental methods.
Wow, so it's as good as the traditional methods?
Pretty much. It's even surpassed the standards set by the CASP competition, which is a long-running challenge in the field of protein structure prediction.
So what are the real-world implications of all of this?
Oh, the possibilities are vast. AlphaFold has already contributed to developing a malaria vaccine, helped fight antibiotic resistance, and deepened our understanding of how diseases work.
That's amazing. It sounds like AlphaFold is like a Swiss Army knife for scientific discovery. It can help us tackle all sorts of challenges.
And it's not just limited to biology either. DeepMind, the company behind AlphaFold, has also developed an AI program called
Genome, what does that one do?
It's discovered millions of new materials, some of which could have amazing applications in various fields.
Wow, it feels like we're on the verge of a whole new era of scientific discovery, and AI is leading the way.
It really does, but amidst all this excitement, it's worth remembering that not everyone was immediately convinced that AI could achieve such incredible feats.
Really? There was skepticism?
Oh, absolutely. The protein folding problem had puzzled scientists for so long that some doubted whether AI could truly crack it, but the results, as we've seen, speak for themselves.
It's another example of how technology can surprise us.
It is, and AlphaFold's success has been a real paradigm shift in scientific research, showing just how powerful AI can be in tackling those really complex challenges.
It's amazing to think that AI could be used to figure out these really complex scientific problems. But let's go back to GrowLSG for a second. What are some of the specific things this program is doing to encourage those healthier habits in kids?
Well, one thing that really sticks out is their focus on creating a supportive environment. It's not just about telling kids what to do, it's about working with schools to make healthier choices easier.
So they're kind of tackling the issue from all sides, not just focusing on the individual.
Exactly, and they're giving resources to parents too, helping them understand how important it is to set limits on screen time and get their kids moving.
It's like they're trying to make being healthy the norm.
That's a great way to put it. And remember those yearly questionnaires and health screenings we talked about?
Yeah, the ones that help personalize the recommendations.
Exactly. That information helps them figure out what each kid needs. So it's not just generic advice, it's tailored to their specific situation.
That's smart, makes it a lot more relevant to the kids and their families.
And they're seeing some good results too. Our sources talked about a mother and daughter who were part of the pilot program.
Oh yeah, I remember reading about that.
The mom said the personalized plan helped her have real conversations with her daughter about healthy habits. It wasn't about lecturing or forcing her to do things, it was about working together as a family.
I love that. It's empowering families to make those healthy changes together.
It really is. Okay, let's bring AI back into the mix. We've talked about how it's being used to understand diseases, but what about using AI to track and manage outbreaks?
Yeah, that's a whole other level. How could AI help with that?
Well, AI is incredibly good at analyzing huge amounts of data and finding patterns that humans might miss, which makes it a really valuable tool for disease surveillance and predicting outbreaks.
So you're saying we could have AI systems constantly watching global health data from things like social media, news reports, even weather patterns?
Exactly. Imagine if AI could spot an outbreak before it even really starts to spread.
That would be a game changer. We could move from reacting to outbreaks to actually preventing them.
Exactly. And AI can do even more than just monitor and predict. It can also help us develop and test new treatments and vaccines.
So it could speed up the whole process of drug discovery.
It could, which is super important when we're dealing with new and emerging diseases, where time is really of the essence.
It's incredible to think about all the possibilities. I mean, what about AI-powered diagnostic tools that could be used in remote areas? Or personalized preventative healthcare plans based on your unique risk factors?
The potential is huge. We're just getting started with what AI can do for global health.
This has been an eye-opening conversation. It's clear that global health is facing some serious challenges, but it's also inspiring to see all the innovation and dedication out there.
I agree. It's a reminder that even in the face of global challenges, we can still be hopeful. Programs like GrowWell SG show that we can take action to make a difference.
And breakthroughs in areas like AI prove that we have the tools to tackle some of the biggest health issues facing humanity.
It really comes back to investing in our future, and that starts with investing in the health of our children.
So what does all this mean for our listener?
It means that we all have a part to play in shaping the future of global health. It doesn't matter where you live or what you do, we can all make a difference.
Whether it's speaking up for vaccination programs, supporting research, or just making healthy choices in our own lives.
It's about recognizing that we're all connected and that our actions have an impact.
And it's about staying informed.
Absolutely, knowledge is power. The more we understand about these issues, the better prepared we'll be to find solutions.
Before we wrap up, I have one last question for you.
Shoot.
We've talked about AI revolutionizing research and potentially changing how we deal with disease outbreaks. But what other problems in global health could AI help us solve, problems that seem impossible right now?
That's a great question. And honestly, it's something I think about a lot. We've only just scratched the surface of what AI is capable of. One area I think we could see big progress is in personalized preventative healthcare.
Oh, interesting. What do you mean by that?
Imagine AI systems that can analyze your genes, your lifestyle, your environment, and use that information to create a custom plan to lower your risk of getting certain diseases.
That would be amazing. It would be like having a personal health advisor powered by AI.
Exactly. It would take us beyond that one-size-fits-all approach to healthcare and move us towards truly personalized medicine.
That's the future I want to live in. What else?
Another area where AI could have a huge impact is in creating really sophisticated simulations to predict and maybe even prevent the effects of climate change on human health.
That's something we haven't even talked about yet, but it's clearly a major concern.
It is climate change is already affecting global health, and it's only going to get worse. AI could help us understand those impacts better and figure out how to protect vulnerable populations.
It's both exciting and a little bit scary to think about all the possibilities.
I agree. The potential of AI is immense. But it's important to remember that technology is just a tool. It's up to us to use it wisely.
That's a good point. We need to be aware of the ethical implications of AI and make sure it's being used responsibly and fairly.
This deep dive has taken us on quite a journey, from the tiny world of proteins to the massive challenges of global pandemics and climate change.
It's been a fascinating exploration, and I hope it's sparked some curiosity in our listeners.
We've seen how interconnected our world really is and how progress in one area can have a ripple effect across the globe. We've also seen the incredible power of technology and its potential to transform healthcare and tackle those major global health challenges.
But at the end of the day, it's up to us to take action, to push for change and make healthy choices in our own lives.
We encourage you to explore these topics further and stay informed about what's happening in global health.
Because as we've seen today, knowledge is power. And it's through understanding and action that we can create a healthier and more equitable world for everyone.
Thanks for joining us on this Dita Dive. We'll be back soon with another one.
Until then, stay curious and stay engaged in the conversation, because global health affects us all. AI is really changing the game, isn't it? It feels like it's got the potential to solve so many problems, even beyond healthcare.
It does, but we can't forget about the more traditional approaches, too. Those programs that focus on building those healthy habits early on, like we were talking about with Grow Well SG.
Yeah, those kinds of initiatives are so important, We need to start early if we really want to make a difference long term.
Exactly. It's about creating a culture where health and well-being are valued, empowering people and communities to make those good choices.
And that brings us back to our listeners, right? What can they actually do with all this information about global health trends? It's a lot to take in.
It can be. That's why we do these deep dives, right? Try to break down those complex issues and highlight what's most important.
So what would you say is the biggest takeaway from today's conversation?
I'd say it's that idea of interconnectedness. We're all connected, whether it's through the spread of diseases or the impact of climate change. It affects all of us.
We've got to remember that, right? Our actions, no matter how small, can make a difference.
Exactly. Every little bit counts, whether it's choosing to walk instead of driving, supporting sustainable practices, or just staying informed.
It's about making those conscious choices that contribute to a healthier world for everyone.
And never underestimate the power of knowledge. The more we learn about these things, the more we'll be able to find solutions.
So to our listeners out there, keep learning, stay engaged, and don't be afraid to speak up for change.
There are so many resources out there, online, in your community, through organizations that are working on these issues every day.
We've only just scratched the surface today, but hopefully this deep dive got you thinking.
The future of global health is really in our hands. It's up to all of us to build a healthier, more sustainable world.
Thanks for joining us on this journey. We hope you'll be back for our next deep dive.
Until then, stay curious and stay well.